Healthcare is in a different mode today, particularly post the Accountable Care Act. And growth is going to be more targeted in specific areas where growth will happen. Inpatient volume is not going to grow at the rates we've typically seen over the last several years because hospitals all over the country are working hard to reduce readmissions, move patients to observation or outpatient care. So we don't anticipate the growth that has been historic for the inpatient sector. But outpatient continues to grow, and we also see opportunities in the home with new types of technologies. So I think that affects other sectors in healthcare, not just hospitals and health systems, but device companies, technology companies that are really going to see, I think, rapid growth with new innovation. Every health system cannot do what we're doing at Henry Ford in the innovation space, but every organization can be open to creating relationships, bringing new technology in, partnering with their patients and their providers, including physicians and other caregivers, in new ways. So I think that's going to be very important across healthcare in this country to really be working at all the intersections, working with employers, working with payers, working with other providers and other organizations that are going to become very important, perhaps disruptive in healthcare today. If you're used to simply working within your own walls, it can be very challenging. But I also think that leaders today need to learn collaboration skills, how to partner. And some of those skills include just being open to new potential, piloting new things, working on sort of experiments to see if in fact some of the new technology can really improve care. There are really two elements that are critical to creating a strong leadership team in healthcare today. One is balance between outside people and internal people, and then also being open to bringing disruptive leadership. And we did that a few years ago when we hired an executive from the Ritz-Carlton chain to run our new hospital. He had never worked in healthcare. People thought I had lost my mind, but I will tell you that without his vision for what that hospital could be, we never would have advanced as far as we have, particularly in health and wellness, in creating an environment that really brings the community in. And we teach and support people in managing their own health. That never would have happened with our traditional thinking, including my own. So it really was maybe the courage to allow disruption and to help support those individuals when they join your organization, because they will make mistakes. They will trip. They will create reaction. But you have to be there to support them. And then I think you take advantage of really that new thinking in driving change. Our leader who ran the West Bloomfield Hospital was an individual who had a special affinity to food. So his thinking around food was very different. He used food as a healing kind of technique. He felt that, basically what we're eating is killing us. So on the flip side of that, how important it is to help people eat more healthy food and that it tastes great, it's fresh. So he got rid of all of our freezers and fryers for that hospital. We now have no fryers across the health system. Everything is baked or grilled. And it really changes, I think, the health content, if you will, for the food that we serve. He also took that a step further, and we now have a greenhouse at the hospital that grows organic produce that is now used for all the cooking for our patients. And we're, again, spreading that across the health system. We have farmers markets in our hospitals. We have a lot of things that I think would never have happened without his insights and his vision. The other thing that we're doing in a much bigger way now is retail. Our health system has had a lot of history in that because we have retail pharmacies, we have retail vision centers. Now we look at all of our spaces in the hospitals across the system as places where people gather, much like airports. They wait around a lot. There's a lot of individuals there who could take advantage of really targeted, well thought through retail establishments. Population health is actually not totally new. If you go back in time, originally hospitals were created in communities to help manage the health of the community. In Detroit, Henry Ford Hospital was created almost 100 years ago because the community really needed those services to improve the health of the community. But we kind of lost our way. We became very competitive, very focused on growing business as opposed to managing population health. A lot of health is not clinical. It is socioeconomic issues, it's transportation, it's housing, it's education, literacy around how to take care of yourself. There are a lot of things that we need to be doing differently, and we need to be connecting the dots. I believe that healthcare, the center of healthcare, is really in the home, not in a hospital. So what people do every day to take care of themselves is as important as those episodes where they might visit a doctor or come into the hospital for treatment. So we need to be much more engaged with patients to be able to help them manage their health in a different way. Many people have only gone to emergency departments or free clinics for care. Now they have an opportunity to have a relationship with a primary care physician or a mid-level provider, or continue in a federally qualified health center or other environment to receive their care. But we're hoping that we can help them really understand how to use the health system more effectively, and so that their outcomes are better and that they have a greater frequency of seeing physicians or other caregivers, hopefully to reduce the more catastrophic outcomes that would result in hospitalization or higher cost. I think the one quality people really need is to be able to think differently. I think we get awfully wedded to what might have been successful in the past, and that sometimes can trap us into thinking that those same strategies are going to work for the future. So I think being open to change, new types of thinking, new types of people within organizations is very important. I think being comfortable with disruption is part of that, because if you really think differently, you can allow some level of disruption in your organization that can be very healthy. Sometimes we want to, sort of dampen those effects. And I don't think that's where real innovation comes from. I think innovation comes from that type of openness. And it's clearly, certainly in healthcare today, but probably in every industry, innovation is very important. And we have to allow that to happen.